Network. We are the worldwide community empowerment group where we speak life into the community and we speak life into you. Log on to WCEGTalkRadio.com. Watch us live on your smart TV, on the Roku cable channel, YouTube, Facebook, LinkedIn, and now on Fanbase, Bluesky, and Twitch. Search for WCEG and subscribe on all social media platforms. I'm Dr. Cassandra Wanzo, your host of Mind Matters. Download our free WCEG mobile apps. Say, Alexa, play WCEG Talk Radio. Listen to WCEG on any of our 12 podcast distribution platforms. Last but not least, the topics and opinions are those of the show host and guest and not WCEG Media Enterprise. Thank you for your continued support. Good evening and Happy New Year. Welcome to Mind Matters, where we discuss relevant mental health issues. This is our first show of 2025. I'm your show host, Dr. Cassandra Wanzo. I'm a psychiatrist. I've been practicing in Atlanta for the past 34 years. I started when I was 4. Our topic this evening is Beyond the Headlines, a family tragedy, mental illness and addiction. Again, Beyond the Headlines, a family tragedy, mental illness and addiction. This evening's program addresses mental illness, substance use, and a double homicide. Difficult topics, and we approach them with care. Care for the people whose lives were lost. Care for those who are living with mental illness or addiction, and care for the families and communities affected. When we talk about murder, it's easy for the conversation to harden around labels or headlines. But behind every story like this are human beings, people who were loved, people who struggled, and systems that too often failed to intervene before harm occurred. Mental illness and substance abuse do not make someone violent. In fact, most people living with these conditions are far more likely to be harmed than to harm others. But when illness goes untreated, when addiction is met with stigma instead of support, the consequences can be devastating. This evening, I'm not here to sensationalize violence or to excuse it. I'm here for us to understand how warning signs are missed, how care breaks down, and what it might take to prevent future tragedies with compassion, accountability, and better resources. On December 14th, 2025, acclaimed filmmaker Rob Reiner and his wife, Michelle Singer Reiner, were found dead in their home in the Brentwood neighborhood of Los Angeles. Both had suffered fatal stab wounds. Their deaths were ruled homicides. And soon after, their son, Nicholas Nick Reiner, was arrested and charged with 2 counts of first degree murder in connection with their deaths. The couple's daughter, Romy, discovered them and alerted authorities. In the days that followed, the case drew intense public attention, not only because of the prominence of the victims, but because this tragedy touches on issues that affect many families. Long-standing struggles with mental health, long-standing struggles with addiction, the complexities of care, and how our systems support or fail those in crises. Nick Reiner, 32, had been described in media reporting as having faced years of addiction and periods of homelessness, and his family members and defense representatives have mentioned his history of mental health challenges. Over the past weeks, proceedings in Los Angeles courts have been delayed as his legal representation changed and his arraignment date was rescheduled. His case remains pending as the family moves forward. When tragedies happen, like the murder of Rob and Michelle Reiner, people often ask, how could this happen? It's vital to emphasize most people living with mental illness or substance use disorders are not violent, and stigmatizing language or assumptions only deepen the pain for those struggling and their loved ones. Yet when violence occurs within families, especially in cases involving untreated or poorly treated mental illness, it raises urgent questions about how we recognize warning signs, how care is accessed or denied, how support systems can be strengthened to prevent future tragedies. Recently, I had a patient who was evicted. Her family refused to allow them to stay with her, stating they were concerned about that Rob Reiner thing, and they refused to allow because they were fearful that something would happen only because of the headlines in the news. And the daughter was not violent, but they were fearful based, on what they'd heard in the news. So why this conversation matters. Mental illness affects 1 in 5 adults. 1 in 5. Substance use disorders affect millions of families. Violence is not inevitable. It often follows missed intervention points. Prevention happens long before crisis becomes headline news. So, understanding the relationship between mental illness and violence, again, one of the biggest myths is that people with mental health issues are violent. As I've stated before, most people with mental illness are more likely to be victims than perpetrators. I can't stress this enough. The risk of violence increases when combined with untreated psychosis, severe substance use, and some of the substances involved that can exacerbate mental illness that I've seen in my practice are cocaine, alcohol, cannabis, yes, methamphetamines, and hallucinogens. So the risk of violence is increased when the substances are combined with untreated psychosis, severe substance use, social isolation, and prior threats or violent behavior. Violence is usually a systems failure, not a single person failure. So the system is usually at fault. What is the role of addiction? Again, substances like alcohol, hallucinogens, cocaine, marijuana can make mental health symptoms worse, especially in adolescents because their frontal cortex hasn't developed fully. So for them, like using marijuana before 21 can increase their risk of mental health issues. So these substances can intensify paranoia. They can make someone impulsive and aggressive. The substances can interfere with the medication effectiveness. The substances increase risk of violence during withdrawal or intoxication. One thing that's important to know, addiction is a medical condition. It's not a moral failing. It's not a character flaw. Again, addiction is a medical condition. So when addictions and mental illness occur together, we call that dual diagnosis. And the risk for violence increases if the care is not coordinated for mental health and substance abuse. I've run into that so many times where a facility will admit a person who has a substance abuse disorder, but if they have a co-occurring mental health disorder, that disqualifies them. They allow them to take the meds for substance abuse, but will not allow them to take their mental health medicines. And you have to treat them both together. You can't treat them separately. Dual diagnosis has to be treated together. People will often do what we call self-medicate. That means they will turn to substances to self-medicate for relief from mental health symptoms such as depression, anxiety, and hearing voices. So, what are the warning signs? We need to be aware of the warning signs that we should not ignore. So, that's where prevention begins and recognizing the warning signs. So, the warning signs, or what we can usually call red flags, are escalating paranoia or delusional thinking, threats toward specific people, fixation on perceived wrongs or grudges, sudden personality changes, always talking about being targeted or persecuted, stopping prescribed medication, increased substance use, losing housing or employment, repeated encounters with police or emergency rooms. It's the pattern that matters, not one day. And in the case of Nick Reiner, there were several red flags or warning sign in his case that I want to discuss. Nick Reiner had a reputation for violence with reports of a recent incident involving the destruction of his parents' guest house, punching walls and furniture while high in stimulants. Neighbors and co-workers were reportedly unsurprised by his they were unsurprised by his arrest due to his history of being troubled and violent. He was also exhibiting escalating instability. Friends and families noted a pattern of escalating instability and an inability to regulate his behavior that had stretched back to childhood but had continued currently. The parents, Michelle and Rob Reiner, were reportedly at their wits' end due to their son's instability. And he exhibited recent erratic behavior. Just hours before the bodies were discovered, he was observed acting erratically at a Christmas party at Conan O'Brien's house, which included starting an argument that caused the family to leave early. It was stated that someone wanted to call the police, but Conan O'Brien said it was his house and he didn't want to call the police. I'm thinking that maybe if he had, things might have turned out differently. So that was a red sign, a red flag that something could have been done, calling the police at that point. There are other missed opportunities where one can intervene. That's when someone's in the emergency room or when the police are called for disturbance. That happens so many times. And in the case of Rob Reiner, the police had been called to the house several times, but nothing was done. That often happens when the police are called and they come to the house, that they just really, I don't know if they don't want to take on the responsibility, but they end up not really doing anything. Other times when interventions could be done, if there are missed follow-ups after hospitalizations, these systems often operate in silos, not together. How do people access care? They can either go to primary care or mental health clinic. They can go to an emergency room. They can call the crisis hotline and mobile crisis team, or there's court-ordered treatment as a last resort. In reality, access often depends on insurance, geography, and persistence, not need. It's often not a case of need, but the insurance. Why is getting help so hard? Many people assume that getting help is easy, but it often is not. Barriers to getting help include long wait lists for mental health care, insurance denials, short hospital stays with no follow-up. Oftentimes, I've had someone admitted to the hospital or committed by 1013 and they're severely psychotic, suicidality. The hospital will keep them maybe a few hours overnight or release them, and they're still unstable when they're released. And that happens more times than I can count, and that's very frustrating for me as a provider. Other barriers, lack of inpatient beds. Many times I'll have someone admitted or a 1013. There won't be bed space. They'll end up staying in the emergency room for a couple of days and then they'll release them. Or oftentimes they'll ship them off to some county, several counties far away. Another barrier to getting help is the fear of stigma or legal consequences. Oftentimes, and I've seen this, people must become dangerous or homeless before they can qualify for help. And the families are often left out of it. Families are the ones that see the warning signs early. Families, privacy laws can limit the communication with the family. The caregivers lack authority but carry the responsibility. Our laws protect autonomy, the person's legal rights, but sometimes fail to protect their life, the patient's life. Family will see the danger coming, but are told there's nothing we can do until someone gets hurt. And again, that's one of the most painful failings of our system. I often do involuntary commitments. It's called a 1013. But on the paperwork, I have to give evidence that the person has done something violent to themselves or someone else in the past 24 hours. They have to actually have done something. If they're very psychotic and need treatment, that's not enough for a commitment. They have to demonstrate violence to themselves or others. So I think there need to be some changes in the commitment laws. In tragedies like the murder of Rob and Michelle Reiner, there are often familiar themes, the themes of known mental illness, substance misuse, repeated system contact, missed opportunities for sustained treatment. How can we intervene earlier before violence occurs? What we can do is support families and communities. We can do this by educating on the warning signs or the red flags. We can make clear crisis pathways. Oftentimes, families don't know who to turn to, who to call, and it's often very confusing. So there should be some clear distinctions on who the family should call, and the family should be included in the care planning. We often utilize peer support and recovery services. These are people who've been through addiction, mental health, and they can become what we call peer support and can really relate to the patient on their own terms, having gone through the experience themselves. So prevention happens in communities, not just hospitals. So, what actually prevents violence? We know what works. There need to be changes in the policy and systems. Again, changes in the policy and system. Unfortunately, I just learned yesterday that our current president is canceling mental health services to the tune of $2 billion for addiction and mental health services. So I'm not sure all the services that are going to be impacted, but yesterday he sent a letter canceling $2 billion worth of mental health and addiction services. People are going to die as a result of this. So rather than, cutting off services, we need to expand treatment capacity. We need more beds because that's a big problem. People, again, will wait in emergency rooms or not be admitted because there simply are not enough mental health beds. Back in the 60s, there used to be all kinds of treatment facilities, but they were basically closed down. So the number of inpatient facilities have decreased, and the focus has been all on outpatient. But people do need inpatient treatment. I'm thinking in the case of Nick Reiner, he could have benefited from some type of inpatient treatment. I'm not sure if the family was planning to pursue it, but some type of conservatorship or guardianship where the judge would implement and say that he would have to be in treatment or what are the other consequences he could impose. But I think that he could have benefited from some type of inpatient care with all the erratic behaviors. So I'm not sure what happened. And as I said, in his case, police have been called to the home numerous times, but he was not hospitalized as a result and nothing happened. So the policy and systems improvement, we need to expand treatment capacity. I can't emphasize that enough. Another important thing is we need to reform insurance coverage for mental health. In spite of the Mental Health Parity Act being passed in 2008 and amended several times since then, insurance companies still discriminate against mental health coverage. They'll cover other medical conditions, but discriminate when it comes to mental health coverage. So we do need parity for mental health coverage. Another important factor, we need to invest in housing. You see all the homeless people, something needs to be done. There needs to be some action taken, against housing. You'll see homeless. I know in some cities, like when I was in San Diego, is a big problem. LA, in Atlanta has a big homeless problem as well. A key point, public safety and mental health are shared goals. They're not competing goals. They're not competing goals. We need early intervention for psychosis. We need care that integrates both mental health and addiction care. We need more funding for assertive community treatment teams, ACT teams. In fact, that's where I work. I'm director of an assertive community treatment team, ACT. We work with the hard to reach patients who don't come into the clinics. We provide 24-hour care. We go to where the patients are. So our staff, which consists of, we have like social workers, myself, the psychiatrist, nurses, voc counselors, you know, and instead of the patients coming to the clinic, our staff go out to where they live, whether they're living with family, a personal care home, a group home, or living in the streets, under a bridge, at a bus stop. We had one patient who initially lived at a bus stop, and myself and the nurse would go and see him, and the nurse would administer his injection right there at the bus stop. He eventually got better, and he's now in housing, and that's one of the things that our program does. The ACT team is provide housing, so there need to be more ACT teams because ACT teams are very effective in preventing hospitalization. What also needs to be changed, there need to be more mobile crisis teams because right now, for the most part, when someone calls, the police comes out and the police is not often trained, in mental health issues, but the mobile crisis team is. And so we need funding for mobile crisis teams who have training in mental health and can assess the situation and make appropriate recommendations. And we need coordination of care after discharge, the proper referral, family involvement. The bottom line, care must be continuous, not episodic. It shouldn't be crisis driven. What can we all do as individuals? Because there's certainly things that we can do as individuals. What we can do is take the warning signs or red flags seriously. Oftentimes in family, when someone's disruptive, the family just becomes, this behavior becomes normalized and they turn a blind eye and, are in denial. And I'm just wondering if that might have happened in the case with Nick Reiner, that his behavior became normalized and they were in denial and they turned a blind eye because something needed to be done as far as him being treated inpatient. So we need to take the warning signs, red flags seriously. We need to encourage help early before a crisis ensues. We need to check in on people who are withdrawn and isolated. We need to support mental health resources in our community. We need to reduce stigma by talking openly and compassionately about mental health issues. If you're worried about someone, please trust your instincts and reach out for help. Tragedies like the murder of Rob and Michelle Reiner are not inevitable. They are the result of missed chances to help, gaps in care, and under-resourced systems, which is now just made worse by the current president, who just announced $2 billion in defunding mental health and addiction services. As I said, people will die as a result of this. When we recognize the warning signs, when we improve access to treatment, and when we support families, we save lives, both those at risk of harm and those who are suffering. This conversation matters and it makes a difference. So, if there is someone you know or love who is struggling, help is available. You can call or text 988. That's the Suicide Crisis Lifetime, anytime in the US. Again, that number is 988. It's the Suicide and Crisis Lifeline. So I don't know if there are any questions from our listening audience. Let's see. Any questions from our listening audience? Let's see. So I'm looking on the link. I don't see any. But again, this conversation matters. So thank you for listening in, and we look forward to tuning in to our next segment, which will be the second Wednesday of February. Have a blessed day and a